All right, so this one is kind of a fun section, I think. There's some crazy stuff. I did an internet search, and these all came from the internet here today. Val, these are some myths about coronavirus. I'm not going to ask you if somebody's going to get ill from drinking the beer. I don't think.
I appreciate that.
We're not
I can't
go
speak
there.
to that at all.
We're not going to go there. Nick over there jokes that a lime will cure it. But all joking aside, let's just run down this list.
Okay.
We'll kind of shotgun them and see how many we can do here. Is it a man-made bioweapon?
There are people who are saying that. However, the World Health Organization has told us that this is something that transferred from animal species to humans. It was not biomanufactured. It's actually a naturally occurring virus.
Okay. Will home remedies work, such as extra garlic, drinking extra water, vitamin C, large quantities of vitamin C, rubbing sesame oil on your body, or showering in rubbing alcohol?
The World Health Organization addressed all of these, and they said that none of these will cure or take care of the coronavirus or COVID-19. If you have any questions about what type of alternative medicines or opportunities might exist, I would ask you to call your primary care physician.
Okay. I got a feeling a lot of these answers are going to sound very similar. Masks. There's a shortage on masks. People trying to find them to protect themselves. Just mask somebody to wear. Are they effective? Are they necessary?
The CDC is saying that healthy people do not need to use a mask. When you go to Sky Lakes, for instance, if you were to report to the emergency department because you were feeling ill, you have potentially the flu, it's difficult to breathe, you've had a cough and a fever, one of the first things that's going to happen is you're going to be asked about what's going on and probably meet somebody with a mask who doesn't want to get whatever you may have, the flu virus most likely, and give you a mask to put on. But the CDC is saying that healthy people do not need to wear a mask. And if healthy people refrain from using a mask, then we're not going to have a problem having enough masks if we need them.
Mm-hmm. What about people? We talked about compromised immune systems, people with compromised immune systems. What about them? Should they be wearing one?
I would encourage people who have compromised immune systems, if they're going to go out, let's say, for instance, they're not feeling well. It's different than whatever has been going on with them. They should call their physician first to ensure that if they're going to go to the clinic, that it's a prime time to do that and they may not be exposed to something else.
Okay.
When they are met at the door, if people feel as though they've been feverish or had a cough, they're going to be asked to wear a mask.
All right. Now, differences in masks. If I went to Home Depot and got a dust mask, is that going to do anything, or does it need to be a medical supply mask?
The situation with masks is there are a variety of grades. So I'm going to take us to the period of time when we have wildfire smoke, and a lot of people are using the N95 mask because that's a very good way to filter some things out. In the world I live in, an N95 mask should always be fitted to your face professionally. So getting something off the shelf is probably not going to be as good as it would be if you had a regulator that was fitted or an N95 that was fitted. If you have facial hair, you're not going to get a good fit. A dust mask in most instances is not going to do anything for you. Folks that think they can pull up a bandana and things are going to be great, that's not going to do much for you. And again, healthy people do not need to use a mask. People who might have a compromised immune system, who might have flu-like symptoms, they need to put a mask on to help protect themselves and others from catching what they may have.
All right. Moving on. One of the things that I found was heat will kill the virus. So when summer comes around, it's gone.
I've heard that myself. And the reality is that we're still learning about this virus. So will heat kill the virus? I don't know at what temperature it would kill the virus. I don't know for what length of time it would kill the virus. We haven't lived through a summer where we've known about the virus. So these are things that we're going to learn. But I would not make the assumption that, wow, when June's here, we're going to be scot-free.
Mm-hmm. Well, there's also been a couple of cases in Australia, if I'm correct, hasn't there been?
I am not up to date on that.
Okay. Well, if there is, they're in summer. So,
Right. Well, 6 a.m. this morning when I looked at it, I could have told you, but
I'm hearing another thing that I saw when I pulled it up. It's just another seasonal flu. Valeree, is it just another seasonal flu?
no. So what sets this apart from the flu is, number one, it's not a strain of influenza. It's a coronavirus. And number two, the symptoms that people who are becoming very ill with this are exhibiting are much more intense than the flu. So at the end of the day, there are some people, like I said before, they may have the virus, they may not have symptoms, or they may have mild symptoms. Mm-hmm. Part of the population is going to have more intense symptoms, but those that truly, that potentially 2% who get very, very ill and have to be intubated, they're going to be the folks that are having a much more virulent experience than you would with a seasonal flu.
All right. Vaccines, they're going to be ready in months. Are they going to be ready anytime soon? I know their scientists are working on them. Is it going to be years out after trials and things like that, or how's that looking?
The way things work in the United States is something is developed in a laboratory, and then it's tested, and then the FDA determines that it's okay to market to the human population. There are other nations that don't have as stringent a testing policy as we do. The Jerusalem Times said this week that Israel anticipates by the close of March having a vaccine. Do I believe that's going to happen? Yes. Mm-hmm. Do I believe that it's going to be 100% effective? I have no way of knowing that. So for United States residents, our access to a vaccine is probably somewhere in the distance. I wouldn't say that come close of summer, we're going to have something good to go.
Okay. And a big one here that I've actually saw in several different places, and we actually talked about this one off camera, mm-hmm. is can it be transmitted through the mail or through packages that come via UPS or anything like that? Say your Amazon worker that boxed your order is ill.
Right.
Can they send it and not even know it?
We don't have any information about that at all at this point. So I can't say 100% certainly that you receive something from Amazon and that's 100% free. I got an Amazon box today. I didn't think twice about it. I opened it up, took my stuff out. What I would encourage people to do is, again, use common sense. If we think that someone may potentially be a carrier of this virus and they pack the box, I'm not going to do something foolish such as mess around with the packing material or pop the little airbags mm-hmm. and put stuff in my mouth. Because it's really that facial touching and good hand hygiene that we want to be thoughtful about. So I don't perceive that someone's going to get a letter in the mail and open that up. The way that we've been afraid of things like anthrax,
right.
I don't perceive that as being a threat. But again, we're learning every day. So if this does turn out to be something that can live for a period of time in shipping material, one of the first places you're going to hear about that is Klamath County Public Health. We're keeping the website updated. And again, you can always give us a phone call. I'm going to tell you what I know to the best of my ability.
And once again, we didn't talk about it recently, what's the website people can check out for information?
It is publichealth.klamathcounty.org/coronavirus.
All right. One other myth I'm seeing out there is kids can't get it.
So what we've learned from China in particular is that the majority of cases and the most extreme cases are in people aged 59 and older with an underlying health concern. Children could get the virus, but we're not seeing really severe cases of that in other populations throughout the world.
So that might be a kind of a partial truth. The pattern is just not there.
Right.
Okay. The last one I've got here that I found, all who get it die. It's a death sentence.
So I just pulled some numbers at 3:30 today from the Johns Hopkins GIS map. And if you haven't seen that, you need to see it because it's showing you in real time what's going on throughout the world. So at that point, 3:30 today, we had 95,124 confirmed cases. Of those cases, 3,254 deaths. So when we look at the confirmed cases and the number of people who have died, that is not even half. As a matter of fact, that math comes out to be closer to that 1-2% mark that we talked about earlier.
Mm-hmm. So roughly 2% can be fatal from catching it. Do you happen to have numbers, and we didn't talk about this off camera, but do you happen to have numbers that compare that to the seasonal flu?
I have seen those charts. The last one I saw, I didn't have time to vet those numbers. But here's my promise. I'm going to look into that, and tomorrow when I update our website, I'll have that list.
All right, so we'll be taking a look at that over on that website. And again, one more time on that website?
That is publichealth.klamathcounty.org/coronavirus.
All right. Well, guys, we're going to be taking our next commercial break. If you've got a question regarding public health or coronavirus or the greater Bonanza area,
yes,
for Valeree, go ahead and get those in the comments below. We're going to be right back after this with more.